When you say digestive enzyme, I'm sure there's multiple different digestive enzymes, there's stuff that breaks down protein and fats and carbs and gluten and butter, all that stuff.
Right,
So
exactly.
what are some of the critical elements? Like, does it depend on the meal, what kind of enzymes you should pair with it, or just take a generic one and it's fine?
Great question. Most people, I would say 80 to 90% of the people will do great with a full spectrum digestive enzyme that has the lipase, fat digesting enzymes, protease, for digesting protein, all the carbohydrate digestive enzymes, lactase and maltase and sucrase and disaccharidase. So, and it has cellulase in it because we don't make, that's a one enzyme we don't make. We don't make cellulase. So what we depend on is chewing. And that's why some people say, well, I can't eat all that fiber because I break it down because I don't chew well. So the enzyme supports that, helps that. Some people need maybe more specifically focused on protein and some people on fat. But most of the patients I've seen do well in just a full spectrum digestive enzyme too. My ECM work, which I guess we'll talk about, one of the things that I teach people this technique is looking at sometimes what you're intolerant to as far as the different foods. And sometimes you can recommend with this technique, find out what another maybe better enzyme would be, maybe more protein digestion, because you could take that on top of the other enzyme if you feel you need to. So, but most people, a full spectrum digestive enzyme is where I start.
Well, like for instance, my wife had her gallbladder taken out.
Yes.
So for her, ox bile works well to break up fats. If we're going to have a meal with, let's say, cream sauces or fat in it and stuff, she seems to need that more than I do because she has a harder time like emulsifying the fats. So that's what I mean. Are there like what nuances in someone's physicality would suggest they should have not just a generic enzyme, but something in addition?
Well, one thing, somebody like, let's say they had the gallbladder removed. One of the things that I've done and what I've been passionate about in my work as a healer, as a doctor, is to find the underlying cause of why that happened. Because getting the gallbladder out doesn't fix why she got that in the first place. So what I would do with my work, my ECM technique, which is an incredible technique, energetic technique that I have protocols, it gets to the root of what is going on. If someone comes in, well, I had my gallbladder removed, or I have asthma, or I have headaches. What is it? What is it? Rather than finding a supplement or a drug or getting it removed. So what is it? So based on that, I would also see what is the underlying cause of that. And you never know. It could be fats. It could be some other things that you're not digesting. So that's how I evaluate what's the underlying cause, what she's not digesting, what foods. One of the things to look at is sensitivity to food. So my technique is about clearing sensitivities or allergies, you can call it. Because guaranteed your wife has food sensitivities. Most people do. And of course, they come from not digesting food. So looking at what foods. So based on all of that, it's a conglomeration of a lot of different things that I look at. I come up with a specific maybe enzyme for her too. And I don't use any animal products in my practice. I'm a vegan. It's not that people shouldn't take ox bile. I know that it works for some people, but what I would recommend is a fat digesting enzyme too, which I have in my practice for sure that I use. And that not only helps you with that, it helps with other things. Like I have found I found that people who have fat digestive problems have problems with thyroid usually. They either hypo or could be hyper, but they usually have a thyroid issue and they always crave salt. So look at salty things. And these are just things I've seen, because everybody is different, and that my practice, what's interesting about ECM, it's very tailored to the person. So we can have two people that have their gallbladder removed and have completely different underlying causes or root causes that cause that to happen too. But fat digestion is somewhat obvious, Yeah.
What about like low stomach acid? Like a lot of people take like Prilosec and all this crap they think they have too much stomach acid, but from what I've learned, a lot of people have not enough stomach acid. So I've taken like biotics, a thing called HCl. It's like betaine and pepsin.
Sure.
It actually helps my digestion like crazy, but it increases my stomach acid. It seems like that's what, So do you run into low stomach acid? Is that a factor or a problem you've encountered?
I encounter that, but again, I look at what are the underlying causes of stuff. Why do you have hypochlorhydria, which is low stomach acid? So I'm like,
who cares why? Just give them medicine. No, you're right.
That's what people want. And that's not what I do, because if what's underneath that, there might be other things that it's causing as well. You know what I mean? So, but betaine HCl is excellent. Again, I don't use it because it's more of an animal enzyme, but I've seen very good results with it. So I understand why it's helped you too.